I know there's the usual thought that I work to get my health care and those who do not work I am having to subsidize. Well, that's only partly right. If you look up the definition for the word employer, you will not see one who pays for the health care of others. In this country of the United States, government laws dictating employers pay for health care per particular guidelines has gotten popular opinion that if you work the requisite number of hours to obtain the health care perk that you earned it. It's not so direct though. What a person earns in the employ of another is related to the work performed. Adding the health care premium to an employer's expense means there is an added cost that would get pushed onto outsiders, consumers, taxpayers for instance. Just think, one who is struggling in life, when going to the store to buy things, they are paying for the health care for those who are in a better position than themselves. How fair is that? For the poorest per government laws and regulations, everyone else is subsidizing them, including those who are not working and getting no paid health care and those who are working and still not getting paid health care. Certainly there is a debacle with health care and associated costs in this country. A good deal is because of employers footing the bill and passing the cost on to others. The insurance companies will charge a set amount per employee per year and then the medical practitioners would get a certain amount, and not as much as they'd probably want to be getting, especially if the employees would go to the doctor far more often with this employer burden of health care than had it been out of their own pocket. And thus it's no mystery why medical practitioners so often not want to do any treatment if they can help it. The system with the over-intrusive insurance system and related to employment cannot be reduced to a cookie-cutter program. Far better and more efficient would be with no insurance and people going to seek medical help when really necessary and not just because I better go since it's free, apart from the nominal copayment. However, to have a system work with no insurance, there you'd have to be much lower healthcare costs like what was around 100 years ago. You go ask your parents or grandparents what happened if someone had to go to the hospital and perhaps a few would say it was free by the government, not a big deal when costs were so much less, or it was paid all at once or over a few months or year time on a payment schedule, no bankruptcy dilemma as we have today. Just consider how much work is involved in taking an X-ray, how much work is involved in resetting an ankle and putting on a plaster cast, maybe $5 and $80, respectively. The industry has gone insane and look at where we are today. Trying to justify costs with how expensive education is does not address the issue. Of course the cost of education should be much lower, but while not dealing with this issue as well as others and the debacle gets bigger and bigger, nor in how medical supplies companies overcharge. Just how much work is involved in treating a dental cavity? How about for cleaning teeth? A profession of picking teeth and possessing merely rudimentary knowledge beyond this. Maybe $20 or $30 each. Again, in trying to justify costs, assuming all existing costs must always be the case doesn't get to the real skill involved and cost of materials in an uncorrupt system. And so, when a person needs to pay out of their own pocket, there would be greater competition in the healthcare industry and prices would go down, yet there is much more beyond this that needs fixing. Employers paying for the premiums creates a greater mess. Employers might tell you that you are costing them an extra $7,000 per year for the healthcare coverage. If you are in great health, perhaps you could bargain with them and request a $2 per hour wage increase and put you on a contractual basis. In this way both parties win. Life has gotten unnecessarily complicated and it's so evident in healthcare. What should be much more straightforward and with much less money involved is not, and as a society, to make life better, we should do what we can do and do them not causing so much strife. I want to emphasize, there are many who are not in great financial shape and are not getting medical care and yet are paying for the health care of others by being consumers and or taxpayers. Why should the downtrodden be left out and having to pay more to enrich the lives of those who are better off? Let this sink in and make some effort to make the system more equitable.